Grazie. In questa ora tarda.
Well, it is very late and I am really concerned about your patience, so try and be as brief as possible. So try to limit my reflections to very few, just a couple of them or three maximum, with which to close our very interesting afternoon. The task I was entrusted is very difficult, so I am not able to tell you what is the ideal solution, what to do to bring all that we heard about in the afternoon into our healthcare institutions and companies. I suggest, though, to do something that is more modest. Let's say we should convince ourselves that this is a feasible change, not only in terms of system change, but at the level of individual companies. Just a word to introduce the topic.
Un po' troppo avanti. Ecco, una parola di presentazione, perché diversamente dalle istituzioni.
And so differently from the large companies that are practically institutions, this logo is not so popular. Healthcare management was recently established, and in fact a year ago, the objective being to disseminate healthcare issues, the culture, the principles and the technologies of e-management. We believe that during this phase, during this period of economic crisis and reduced budget, having instruments to be able to cut costs and improve the efficiency of services is a very important tool. So I would like to outline this in three main sections, and I'll be very quick in this. First of all, I would like to agree with you on the meaning of change management. I really agree with Professor Maruzzi. I do think that there is an old ICT period and the internet era. The healthcare system is approaching this world now, and this is our world. I think that a conference like this is very useful because it allows us to see things in perspective and also to comprehend the importance of the internet. Secondly, what's going on in the world of technologies? And this is the point of view of a non-expert. I am a simple consultant. I am not, as I said, an expert, but being a user of technologies. And I would like to say something about these trends that are now quite evident, not only in the healthcare system. Lastly, I would like to draw some conclusions. So, as I said, the assumption is that the change is possible and it is feasible for our structures, for us all, provided that we know where to go, provided that we do not simply feel attracted by technology, because technology offer is a giant offer. What should guide us isn't so much technology per se, it's something different, it's something else. First of all, clarification on change management. When we think of this term, probably we think of change management as Professor Maruzzi called the old informatics, the 20th century information technology. It is made up of prerequisites and data. The objective of any organization is to adapt to information technology, a sort of mutual adaptation between technology and organization. And a prerequisite is that the latter should adapt to the former. When we speak of change management, though, we mean something else. We mean to raise the level of services to patients and their families. And this is really feasible because development of technologies resting on the internet is going along this very direction. I mean, this is a favorable situation. We need to capture the opportunities. What I'm talking about, looking at this two scenario, I try and make a sort of very quick overview. And based on this, there are two main directions we should consider. A first one is the shifting from fixed to mobile devices. And in fact, some of the rapporteurs really underlined the issue of mobility, which is dominating. Fixed devices are now being replaced by the mobile ones, also by the users. This is a general trend over and above their use in the healthcare. But this is an opportunity for us. Second, from the monolith, from the information technology as a monolith, we are shifting towards something which looks like an icon. I mean, the software, the applications used for mobile devices. And in fact, I was really struck, Professor Mauruzzi, when you showed us the electronic health file. You showed us your tablet. So, a mobile device, and through your mobile device, you had access to your own information. This is very important. This is a symbolic change, not only a technology change. This is not a gadget. This is not a fad. It's a new window of opportunities. As far as the first trend is concerned, I only have one slide. You find many more data on this. However, in a few years' time, mobile device will exceed the number of users having access on the internet. I mean, mobile devices will have more users than those using fixed terminals, which implies giant changes, opening important doors to things that were impossible, like the issue of rendering services at home, at patients' home. And of course we need the infrastructures, the networks, we need equipment specific for the system. However, given such tools and equipment that are being developed, opportunities created thanks to them are really numerous. And as I said, I would like to make an overview. I'd like to show you a few slides on what's going on. Internet means connectivity, not just connectivity meaning cables, connecting people. Well, this gave rise to the social networks. Social networks in the medicine field is extraordinary. Networks among physicians, exchange opinions on clinical cases. We have very good examples. There are also companies, profitable companies listed in the Nasdaq, just to quote one of them, Therma. Well, this little by little will become our background when mobility increases. Today, this world is represented by the applets, applications for mobile devices. Apple, in fact, was able to open a world. Behind Apple, there's much more. There is a whole world, the world which refers to Android, which is just as wide or rapidly increasing. So what are they? Just as many applets or applications, each one of them performing a function or a few functions which are not integrated in complex suites, characterized by easy access. So if you go to the Android market or App Store and key in medicine, you will see a growing number of applications that were made for this world. And it's just the tip or the top of the iceberg. It is the off-the-shelf offer. It is what's available to one and all, which doesn't exclude that there are ad hoc tools. Quickly, this is just an overview. These are equipments we use in the operating theater. This is a device for anestheticians, computers to calculate doses, and tools to be connected in case of emergency, the mobile emergency with the reference hospital or the network of reference. This is very interesting. It's Italian, by the way. Devices and support to work in clinical emergency situations, to have access to information on drugs, diseases, diagnosis. This is one of the most popular ones used in the USA. And then the reference guides, these are tools, to have a very quick access to manuals, to guides to be used for educational purposes, like these atlases or interactive games, etc. Another application, it's one of yours. I didn't choose because it's one of your applications, but because it's very interesting. And then device for ICD-9 code or to send certificates. Here we have all the processes that are part of a healthcare organization. This world is changing, and we have to be very, very careful because there are new opportunities ahead of us. Some of them were already detailed and illustrated by the previous speaker, so I quickly reach the conclusions, skipping some of the slides. Now, the conclusions. So the idea is the how. There are no recipes. Nobody has it. And what we might use, what we might do, rather, is to make an effort to understand whether there are signs along this virtual road. How can we call them? Sort of reference elements, benchmarks that help us not to lose our ways. The challenge ahead of us is to move from a world whose aspiration was to fully integrate everything. Of course, it's a very important value, to a world that's dominated by the great ease of access and also low production costs with a very high risk of dispersion, fragmentation, scattering. So what we should really do is to avoid and do as this little red hook girl which ventures in the wood, and then she is distracted by what she looks around. If we go out of this metaphor of Red Riding Hood, our direction is very clear. It's the vision of services we wish to provide to our patients in our structures. And then don't lose sight, never feel fascinated, so to speak, by technology that is offered. It is a very abundant offer. And so there are three main conclusions. Well, the direction should be indicated. Speaking of change management, we refer to the increase in the performance level. So we should ask patients where to go. So any development should always take into account the real problems to solve, problems of patients and citizens, like patients and their families. This is a list of, but you know, for many years, inquiries on patient satisfaction, they repeat the same things: bureaucracy, red tape work, and what to do to connect and communicate with different institutions, access to services, possibility to not to be unrooted, especially if in case of severe illnesses. And although a lot of experiments are there, there remain very, very important themes, and they are our reference. Second theme, it is reassuring if it is true what Professor Vella from the Polytechnic told us when he spoke about the observatory. Private structures spend less if we look at them from the point of view of the individual company. Spend less in terms of ICT. So new technologies now available are less expensive, provided that the infrastructure is available and it's just appropriate to have a good system in place. So the important is to improve, to learn, and see the opportunities, see where to eliminate wastes, which are not always so visible. One last point, and I close. The very important thing is to design services and not technologies. We should always have in mind that we are not looking for the ideal technical solution. The important thing is to figure out a new service, redesign the service, thinking of it in the light of the new opportunities offered by the internet world. And in my opinion, this could be done involving patients and their families in the design of new technologies and services, because they can give us a fundamental contribution, that is to say, what is really important for them. So how and do all this? How to learn and see wastes, understand what's the value perceived by our patients. All this should be done according to a method. I think there is a method, a very feasible method. It is called lean management. The lean healthcare is just its application to the healthcare system. The function is helping organizations and work better, efficiently, with the support of technology, thinking of services, first of all, and technology just as a support. Recently, we published a very important case study of a Boston hospital. Sorry, the UK, says the speaker in Italian. The volume is available from August, but we thought it was a very important thing. So We have provided copies of this volume for you. Thank you.